Okay. Which of the following conditions is the most likely diagnosis for this patient? A 55-year-old woman is admitted to the ICU with severe pneumonia. She has a history of type 2 diabetes and hypertension. Over the next few days, she develops progressive dyspnea and hypoxemia. A chest radiograph reveals bilateral infiltrates. Her PaO2 FiO2 ratio is 150. Which of the following is the most likely diagnosis for this patient? Okay, my thought immediately was ARDS just because of bilateral infiltrates and she's in the hospital and it was kind of over the next few days, it was like rapid. So I'm gonna initially click ARDS. Um, I don't see at least any. I think pulmonary edema would be more unilateral. I mean, it could be bilateral, but pulmonary edema could, I don't know, I wouldn't say that. COPD exacerbation. I don't, I don't know. I don't think so. ICU, pulmonary embolism, probably not because it's not immediate. It wouldn't happen like in an hour. So no, lung disease. Oh, go ARDS
All right, ARDS.
here.
All right. Yeah, so you worked this beautifully, right? Key thing is, you're talking about ICU, inciting factor, pneumonia, chest x-ray, bilateral infiltrate. So that's going to eliminate a lot of things if it's bilateral, right? And she's sick. So usually an inciting event such as trauma, sepsis, anything like that, that's going to allow you to kind of lean towards more ARDS. But I guess my question is on a chest x-ray, what does ARDS look very similar to? Oh, can you hear me? Can you hear me okay?
Yes, I can hear you now. Sorry, it just kind of
Oh,
froze.
yeah, you're good. You're good. You're good. Yeah. So, like I was saying, yeah, ARDS is going to be your best answer choice here. I think you worked through that beautifully, right? There's an inciting event, right? ICU care, right? Severe pneumonia, right? Getting worse and worse and worse in an acute setting that's rapid. That's going to all fit clinically with ARDS for sure. Also, kind of your chest radio or chest X-ray, right, is going to bilateral infiltrates. So that's going to narrow it down. I guess
Mhm.
my question for you is, on a chest X-ray, what does ARDS look very similar to out of these
Um,
answer choices?
Maybe interstitial lung disease with honeycombing.
Honeycombing, not so much because remember in ARDS, right? It's like complete whiteout, I would say, right?
Also, pulmonary edema,
Pulmonary.
embolism. Sorry.
Yeah. Pulmonary edema is usually on a chest X-ray. It's going to be on the inferior portions of the lung, I would say, due to gravity. So actually, COPD looks very like exacerbation, meaning like complete lung whiteout is very very similar to ARDS on a chest X-ray. So that's why a clinical diagnosis is so important. So of course,
Oh,
if
okay.
had history of smoking, had history of COPD, then all of a sudden, comes in with worsening shortness of breath, things like that, then you're
Yeah.
thinking more COPD with that kind of chest x-ray and clinical. But of course, this is, very, very sick, right? You need an inciting event, meaning, sepsis, trauma, super, super sick. And so she fits that criteria. It's better ARDS.
Okay.